Hi there. Common question, what's a Morton's neuroma and how do you treat them? Morton's neuroma is a pinched nerve, usually between the third and fourth toes, sometimes between the second and third, and sometimes both. Nerve's actually a little thickened. The symptoms are pretty typical. Patient will report that most of the time they feel completely fine, and then something sets off the nerve. It's usually a certain pair of shoes, an activity, or sometimes just being on your feet for a prolonged period of time. It often radiates into the toes and is sometimes associated with numbness. Patients report they take their shoes off, rub their foot, and then it seems to settle down. But it can be quite disruptive and interrupt your day and your exercise and so forth. The diagnosis is made by history, by examination. X-rays will be normal. Sometimes we'll do an MRI or an ultrasound, but usually not. For some patients, they just need reassurance that this is nothing to worry about, and they can deal with it and just get on with their life. Most patients, by the time they see me, the foot is bothering them a reasonable amount, and I'll try some simple orthotics. You really don't have to spend much money, maybe $20, $30, and often that'll give patients relief. For patients who don't get relief from the inserts or the orthotics, a shot of cortisone can be helpful. The next question is, how often can you get the cortisone shot? If you get one once or twice a year, that's probably fine. And then there's a small group who just cannot resolve the problem between shoe modifications, orthotics, injections, and those we operate on. The surgical procedure is quite simple, but everything in the foot takes a little bit of time to recover from. You're off your feet for 2 or 3 days, then you can put full weight on it. You're probably not back in a regular shoe for about 3 or 4 weeks, resuming activities such as stationary bike elliptical at around a month, hopefully running tennis around 2 months, but there's a little residual soreness that lingers for maybe 3 or 4 months. In appropriately selected patients, and that's a small group because most people can be made better without surgery, the surgery is very effective and gives patients tremendous relief.